And it's a high-stakes tug-of-war between your heart and your blood pressure. And trust me, you want your heart to win this one. So let's start with the basics. What even is blood pressure? Picture your arteries as a network of highways. Your blood is the traffic and your heart is the engine pushing it all along. Blood pressure is simply the force of that traffic pushing against the highway walls. A little pressure is good, it means things are moving. But when that pressure gets too high, a condition called hypertension, it's like a constant system-wide traffic jam that puts a massive strain on everything. Imagine those highway walls, your arteries. Day after day, they're getting hammered by this relentless pressure. What happens? They start to get damaged. They lose their flexibility, becoming stiff and narrow. It's like trying to push water through a clogged, rusty pipe instead of a clean, flexible hose. It just gets harder and harder for blood to flow smoothly. Now your heart is a trooper. It sees the problem and says, okay, I need to work harder to get blood through these stiff arteries. So the main pumping chamber, the left ventricle, starts bulking up just like a muscle in the gym. This is called hypertrophy. It might sound like a good thing, but it's a desperate move. An overworked, oversized heart eventually gets tired. It becomes less efficient and over time starts to weaken, leading to serious problems like heart failure. And this isn't just a heart problem. This high-pressure chaos creates a ripple effect throughout your entire body. Your kidneys, which are basically superfine filters, get damaged and can't clean your blood properly. The delicate vessels in your brain are at risk, increasing your chances of a stroke. Even your eyes can be affected, leading to vision loss. It's a vicious cycle where high blood pressure damages organs, and that damage can make the blood pressure even worse. This is why hypertension is famously called the silent killer. You might feel perfectly fine. No symptoms, no warning signs. But behind the scenes, this quiet damage is accumulating year after year. But here's the good news, and it's powerful. The science is crystal clear. Research from the American Heart Association shows that even a small drop in your systolic blood pressure, that top number, by just 10 points, can slash your risk of major cardiovascular events by about 20%. Think about that. A tiny shift in a number can have a massive impact on your future. So how do we win this tug of war? It's not about one grand gesture, it's about small everyday choices. It's about being a little more mindful of salt in your diet. It's about finding an activity you enjoy and just moving your body more. Managing stress, getting a good night's sleep, and yes, taking medication if your doctor says you need it. These aren't chores, they're acts of self-care. Ultimately, looking after your blood pressure is one of the single most powerful things you can do for your long-term health. Those little numbers on the cuff, they represent a huge story about your well-being. So listen to that story. Make those small, healthy choices, because every single one is a vote for your heart. And trust me, your heart will thank you for it.